fucking nose. The fucking nose. The fucking nose. Ah. Make sure this loaded. Let me make sure this is backed up. Okay, I got a few items backing up. Should I do the ugly part of the news first? Should I just get rid of like the hard part of the news? Yeah, heard it was very messy last night. Should I do the hard part of the news? Should I? I think you know what? After I heard this, I think I'm gonna go ahead and I did hear this. I did hear this. I did hear this. Thought it was kind of funny. Official. Gave yourself the official bushwasher cadence. I saw this and I said, oh, official bushwasher. Official bushwasher. I said, okay, bet. I said, official bushwasher. Heard this.
Welcome in, everybody. We're just listening to other people's drama because sometimes in life we mind other people's business because our own business just, we don't want anything to do with it right now.
Yeah, we mind other people. We mind other people's business. We be all up in other people's business. Hell, don't be in the shit. Hey. We be all in other people's business. So I think I want to do the hard part first. The hard part first is Casper. They got questions. They come into your room and they ain't asking you no questions. But they got questions about the things going on. I gotta be honest. They got questions. They said, hey, I ain't lying. Don't eye me. Come on. They leave. They leave me. They come to me with all the questions that they not asking you because I understand they think they gonna get blocked. So there's a bit of confusion going on when it comes to Casper. They want to know. They want to know, and I don't know who AG somebody is that you was going to pull a loan for, that they said that you was going to get a loan for the individual, and then they confused. They confused on how you was going to get a loan, but you got a GoFundMe, and then they was confused about you go into the emergency room and being unalive, but you out, and usually they watch people for like more than just a day if they resuscitate each. I'm just saying what they saying. I'm just saying what they saying. I'm just saying the things that they saying. She was in the hospital. I'm just saying. I don't know nothing. I don't know what's going on because I don't know what kind of illness she may be dealing with. Listen, they got questions they dropped in my inbox, and it's the hard part. Why I can't ask no questions, don't they? I mean, okay, who, what, when, where, how. 5 W's. 5 W's. The 5, appreciate that. I appreciate you. When, where, who, what, when, where, how, and why. Who, what, when, where, who, what, when, where, who, what, when, where, why, and how. These, they be coming to me with questions, and I'm just trying to get answers. See, she said she was released in 24 hours. See, that's what I'm saying. That's what I'm saying. See, you got questions. See? Don't you? Hey now. Yeah, see, someone can have a illness, but still just, I'm not trying to be disrespectful. Somebody can still have an illness, but they still have questions. Why y'all getting mad at me for just the questions? It was about Casper. They've been in my inbox about Casper and... Okay. I got you. I understand.
Hey, since May is in the comments and they're kind of spreading misinformation, I just want to clarify, like, I'm not questioning Casper at this point because I don't know what's going on exactly. I'm here to listen and see what you have. But yesterday at about midnight, she had someone, Blue, went into Smash's live and told people they needed to come get me to go to this Brooklyn's page because she had flatlined. She posted a video 6 hours before that at home. Now, we were told she had flatlined. She went to the hospital. She woke up for a second, said she wanted a cheeseburger, passed back out, and then she basically was not in a good condition. But this was all in less than 24 hours. So I just want to clarify that the information we were given was not 72, which is what Nay is in the comments saying. It was literally, she was fine yesterday at 3 p.m. and then she flatlined sometime between then and midnight my time, and now she's out of the hospital is what we're hearing. So I just wanted to come up and say that was the timeline we have.
Yeah, we got the same time. Same time. Thank you.
Okay.
Thank
I'm
you.
dropping.
Yeah, thank you. We just in the bush with questions. We not questioning no one's illness. The folks is just confused about the GoFundMe and I can't yeah, okay.
Hey, Pastor Petty.
Hey now, Casper. I'm not I know you got a fatal illness if I'm correct.
So here's the thing about my situation. I have an array of conditions, and all of them by themselves are not, considered. I have anemia, I have neutropenia, which if you don't know what that is, I can explain. I have
And
POTS.
you don't have to explain. I'm not a medical profession, so it's not going.
So,
Yeah, that.
so I have anemia, I have neutropenia, I have POTS, and I have stage 4 endometriosis. Now, the endometriosis was very contained for quite some time. However, when I had a tumor, I went through surgery, and the endometriosis spread after that. It spread to multiple areas of my body, which is very uncommon. In University of Michigan, I have all my documentation from them too. They have been working for a year with hormone therapy to keep my endometriosis and the bleeding stable. However, they found that they don't have enough experience with POTS and with neutropenia to safely do the laparoscopy. So what they would need to do with my endo is do a laparoscopy like they have on my abdomen before, but it's not just my abdomen. And so with neutropenia, it's kind of like lupus. It really affects my white blood cell count. So they need a place that is literally experienced with all of these. The Cleveland Clinic is. The problem that I'm having is every time a cyst bursts from the endometriosis, my body cannot fight the infections because of my neutropenia and because the POTS and all of the symptoms colliding. So the surgery I need is absolutely getting scheduled now because I have literally been in the ER 10 times this year alone from and it's just been a complete mess. So yes, I did quit breathing. Yes, I was in and out of the hospital all day. And yes, I was scrolling on my phone because I don't like watching TV. As far as the GoFundMe, y'all, I just had literal family members up in my live. So I don't know if anyone told you that. I had people from real life come up. My husband lost his job, okay, because of me. He was leaving work to come take care of me, and at Michigan, it's an at-will state. They don't give a flying crap. They don't care. So they fired him. And that was harsh. That was really embarrassing. That set us back. So we are a little bit behind on rent now. And with his pay, he got an immediate job. He was like, fuck that. He's working cash job, but we're just time sensitive. We've run out of time. We struggled with getting a lot of benefits. However, we did end up he wasn't there for a year piece. Yeah, he tried to get FMLA, but you have to be at a job for a year to get FMLA. So we definitely tried the FMLA. Thanks to Rissa though, I did not get much help from DHS. We have proof. I have emails from me and the state rep. I went to my state rep. But thank you to Rissa so effing much because she showed me like a tip or trick or whatever. And I was actually eligible for food stamps. So now I will be getting those thanks to Rissa. And that will help with my diet too. But literally the GoFundMe was my family's my mom's retired. She's retired. She used to be a corrections officer. Now she's not. She doesn't have the money she used to be able to shell this out. And so we literally just have 2 weeks where we need to pay our rent and do this surgery. And that's it.
Oh, so the GoFundMe ain't none of my business.
I mean, like
The
I
question,
messaged you, did I not? Pastor Petty, did
yeah,
I
but
not? I was like, if you want
that
to know, we can talk about it, sir.
that's not the part where the questions are coming to me. The
Yeah.
questions that are coming are about a loan that you would take out for someone, and if you were going to take this loan out for someone, someone named AG, who was coming up on hard times, you offered to put out a loan for them.
I don't even know who that is. Can I see a receipt?
Was it ASG? It's
Oh, yeah, when I offered to apply for a loan when he got doxxed, and then I got told I didn't have the credit for one.
so yeah, they
But I
were.
had a job then. I also recently lost my ability to work. I was working 3 jobs. I've worked my whole life, so I had a job then.
I think that's where their confusion comes in with the loan offer, and if you were able
Well,
to
like if I
do.
already had the money. Okay, no, I did not have the money on hand. I offered literally, because I was so upset for him, I literally offered, like, do you want me, like, I could go get a loan. And then when I went to go call my bank about it, they said I didn't have good enough credit and I wouldn't even be approved for a loan. That's just
And
who I am
then
as a friend.
and then their other question was about
I do
yesterday.
have insurance, guys, now, though. Please, please, if you don't know anything that's happened in the last week in the comments, shut up. Sorry.
And then their other question, not mine. I don't have
Okay.
that question.
Okay.
Their other question was about the hold on. Let me just take
No,
this call.
and if he never asked me for it, he didn't need it. That was me being, I'm very protective of my friends. That was just like something I totally offered. Totally offered. So yeah, the flat line, because I quit breathing. I was completely, I was in and out of the hospital. I did CPR. My kid had to stay up all night. My husband's home. Like, my whole family went through hell last night. Well, not really, mostly me, but like,
Sorry about that.
but
There.
the thing is, when they got the update, you guys have to understand, when you guys all got the update, that was hours after it already happened. Hours after
Okay.
I'd already, like, this was at the very end of everything. I literally flatlined for like 2 freaking seconds.
Well, it
Debs,
was.
I was telling people all the way at
Catch
2
the.
p.m. I told mama yesterday, I told mama at 2 p.m., I can't breathe. There's something going on and I need to go to the hospital. Mama can tell you that.
Um, Casper, I think they were also confused because your husband was in a couple of lives at the time saying, I believe that it was somebody's fault. If
No, he wasn't. Nope, that was Nico. That was a family member. My husband was not on any
Okay,
live last night, and there was no receipt
okay,
for that he
okay,
was. No
okay,
receipt. No
okay,
receipt that there was. I promise.
okay.
I can't
So
do
that
it.
person is a different family member.
Yeah, that's a different family member who was watching. And it's because people this week sat up on a platform and spoke on this GoFundMe and said, oh, because I think I know what was happening 3 weeks ago. You didn't know that this already happened to me last week. You didn't know I quit breathing last week. You didn't know what happened the last 3 weeks. You didn't know I lost my job. You didn't know a lot of things. And you got up on a public platform. And then when I tried to very politely come up and speak my side, I was muted and I was blocked.
And
So I tried to defend myself.
I
Not on
wonder,
you, Petty.
do you
Not on
want
you.
to name
Sorry.
drop? Do you want to name drop
Yeah, I
exactly?
animal guard, and I have Scout saying, yeah, like Scout was like, she's here. I muted her. They muted me. They blocked me when they were like, oh, well, TMZ offered her help with her medications. She did. And I have over and over and over thanked that girl for her advice because it got me in a better situation. Same thing with Rissa. And then it was said, oh, well, you should do your research, blah, 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 blah. There's nothing to research. We
Okay.
literally fell on a hard time. My family asked for help. I've gone through absolute hell medically, and we got thrown a couple really bad things. And I'm not lying about anything. You guys muted me and blocked me. All
I
I
don't got
did was
no.
ask to
I
come up.
don't
No,
have
I'm not
nothing.
you, Teddy, sorry. But
I
Lily,
don't got
you're a
nothing.
goddamn liar. I've never asked for money. I've never asked for help before. You're a liar. Everyone saw it and they were telling you what was wrong. I came in, and Christo, I will show the screenshots. Christo invited me to the live to explain what happened with Dalton and that night with the BB gaming thing. And when Christo invited me, I heard you guys saying, not Lily, because she wasn't even in the live from what I remember. You guys were saying awful things about me. I heard Scout say, well, she's here. I muted her. And then when I asked to come up, y'all blocked me. I came in on my profile, my main profile, and I said, please let me up. Please let me up so I can explain. And what y'all do? You muted me. I did nothing to you guys, and you spoke on my medical shit. I
Casper.
would never
So
speak on any of
showtime.
you and
So
your GoFundMe's because
the
I would
showtime
never do
coming.
that. You're
Timer
awful.
coming.
Oh, my heart. There's nothing deceitful here. There's nothing perfect. Literally, that's what happened. Okay, y'all. We fell on a hard time. I blocked you because you follow Bree. That's all. I'm sorry, honey. I tried to tell you it was just because of the Bree thing. But I literally, there's no fake GoFundMe. You're such a fucking again, we fell in a hard time. I'm going through a lot of shit. I lost my ability to work. My husband randomly got fired. We weren't expecting it. So my sister listened to my doctors and listened to everyone around us and was like, "Hey, if you need help, do what you need to do." My doctors have gone above and beyond. The thing we need is it's time sensitive. It's not like we need this money. I'm applied for disability now. I have food stamps now. We have things going on, but literally, my husband lost his job trying to take care of me. He lost it for coming to me.
Hey, I'm only here because someone sent me the smoke signal, my name. Okay, because time be flying. I just have a question, maybe two. I gave you the information about food stamps. I understand the county getting assistance. I was trying to give you some support. I don't want to ever question anybody's anything, but it didn't make sense to me that I gave you that information. You said you applied at 6:30 something your time, and then by 8 a.m. the next morning you were already approved. Anybody that's been on the county, been with the county, I worked for the county. I just kind of was curious how that happened. I'm happy that you have assistance. Don't receive it in a negative way, but it just, the math wasn't mathing in that sense for people. And then you also mentioned that you had got that job at 1 a.m. and you only need help for a week. Hey, so I had the Comic Cousins ask me some questions, and I'm just going to put them out here. This is me questioning, just bringing some questions that people in the chat had. I want to preface that because I get dragged all the time for asking questions, so just so we're clear. A lot of people are very confused on what happened last night. It's the timeline, the flatlining, how did the hospital release you so quickly afterwards, because anyone who's flatlined before in the comments, or they have people who have done it, have said they keep you more than just a few hours. So the timeline is not working out for a lot of people in the comments. They're asking questions about it. I was asked to come up here and just ask for that clarification. So I know that people would like that addressed, less so than kind of the messy part of TikTok. They're just trying to understand how you're here right now back at home.
Kind of like the same thing she was just saying was last night I joined the live because it was sent to me to Brooklyn, and I listened to what Brooklyn had to say. It just didn't make sense to me that you flatlined and then you were released from the hospital and you were on TikTok live this morning, and it just seems like, I don't even want to say it. I'm just hoping that it's not a play, and it just seems very weird. It's just because I've worked in a hospital. People don't just get sent home after they flatline, and that's what we're kind of confused on. And same thing with Mallory said, and I feel bad if it is a play and I got Mallory dragged into it, and there's no hard feelings with you, Casper, but it's weird.
Hey, so also, I just want to touch on that fact. I agree. I do believe that it is something there that is just not adding up. I got a message from you yesterday, Casper. I don't know what time. That's why I was asking what time you went. I don't know what time you went, but I know I got a message from you yesterday, and then I don't know if it was your nephew or your cousin or whoever. I'm wondering, was your nephew with you at all at any time? That's something that I want to ask you really quickly, and that's all I really want to ask.
Yeah, absolutely. So now I understand. I think that was probably miswording then. My husband is not the best. So I keep hearing that you guys don't know. I was in for 5 hours the first time, and the reason I was because I quit breathing. The second time I had quit breathing, they had no heartbeat for a second. They had to do CPR. So that is why my husband had said flatlined. Okay? That is where that came from. If that was like, and yes, my cousin was with us and the family watching my mother flip the hell out. My mother was up at 3 a.m. bawling her eyes out. My cousin was also watching all of you, and yes, it does hurt. P.AME.C, it freaking hurts. Yes, it does. I don't owe any followers money. You guys are crazy. I'd love to see receipts, but no.
Oh, it's me. It really hurts. That I have to say. None of us want to come off like, oh my God, we're talking bad about somebody and their health. But I have given CPR and it's traumatizing, and you're not bruised. You're fairer skinned. You're sitting up. You look good, girl. I mean, it's no shade, but you're not even addressing like some of the questions that people have had in terms of like, I have the question about your offering you support with getting the assistance. Like, if you had it, you had it. There's no shame in the game. I swear to you, there is none. The back and forth with the job, you needed the money for the rent. I want to support you, but I don't know how.
I'm going to take a second and talk to the comment cousins. Everyone, there's literally a lot of questions going on. Please stop making accusations in the chat or we need to figure out one thing at a time. I know that people have been bringing up something about cancer last month. I am going to ask about that. I think that we do need to be sensitive that there are people in the chat who have disabilities or illnesses, and we don't want to come off as if we don't believe anyone or everyone. We have questions, we need answers, but at the same time, like, you have to be willing to answer those. I don't think it's okay to ask her or demand her to like show her medical papers. I think like that's something she has to decide if she's gonna do. So to those people in the comments, like, please stop commenting that part.
I don't want to see nothing.
Yeah, so I was asking if your cousin was around you or with you, because last night in some lives, your cousin I have screenshots, your cousin was messaging me or commenting to me saying that you were crying so much for me after what Dalton had did to me the other day, and so on and so forth. And then also I had gotten that message from you after the Dalton stuff. So yeah, I guess I am just a little bit confused on like the timing and the stuff like that. And like everybody else has said, I don't want to question anybody's health issues or anything like that. But I will just say that some of it seems a little bit just odd.
Okay, I'm gonna try to do this as quick as I can. Yes, Rissa, they did say that they can approve me. I'm not like, I don't have the card yet or anything. Like, they did, but they told me, yes, that changes the situation. She said I will be approved now. I will get it. And so that's why I came to you and thanked you. I don't know what my cousin was saying, but yes, he's right. I told Petty, Petty can prove it. I messaged him and said, I'm in the hospital, but I'm listening. I'm scrolling. The nurse is making jokes about how it's a soap opera. Petty can vouch for that. I was in the hospital the entire effing time that I was messaging Petty, all of them. I'm trying to think of anything else to answer. I've had an array of medical problems. I have no problem going over my chart with people and everything that's happened. The job, yes, I have. I don't get to start it yet, but I have to go through 2 weeks of training. Please let me know if there's any other questions I missed. I don't fucking know.
Oh, me. My flabber is gasted. I'm happy you have assistance. In the history of the assistance giving, getting, working, I have never seen somebody respond to a case in 10 hours and approve them, especially when it's overnight. But if you have it and it's working for you and you need it, more power to it. I'm happy you have it. I'm happy it's working out. I'm going to remove myself. I do hope you're well. I hope you're getting well. I hope you get what you need. I don't want to be in the middle of because it's still not making sense for me, but it's not for me to make the sense out of it, I guess. So I love y'all. I'm gonna exit.
Yeah, I'm kind of in the same. My guests are a little flabbered right now and trying to make sense of it. I know a lot of the questions in the comments still are about the flatlining and the being released so quickly. The cancer thing does keep getting brought up in the comments. I don't know what that's about. I didn't know that was a thing. But someone is saying that last month there was some stuff about cancer said and that it seems to have just kind of gone away. So I want to hear people out. I don't want to assume anyone is making anything up or anything, but I think there's a lot of questions, especially with the flatlining and the CPR, and there not being ribs broken or things like that. And then I know now the job is being questioned because you did just say you can't work. So it's spawning more questions than answers, I think.
Since we're up here and it's a learning experience, can you guys hear me? Okay. Since I messaged you privately, now I think would be I'm probably not the only one who has the same question that I DM'd you, but can you clarify, because it's worrying me when I saw you crying on live earlier this week that your doctors said you have possibly until only December to live. What conditions or a combination of conditions is it that's causing this life or death situation? And is the surgery going to fix that? Because I've looked up POTS. It's about racing heart, causing fainting, which you have described that you do experience. And then endometriosis, I do know that it can spread like it has in your system. And I think you said that it spread to your brain. And I think you said the surgery is going to focus on removing that as well.
Yes, and I mean, we're on timers, so you guys, I have no problem talking to you about how my POTS and my endo and my neutropenia are not working and how all of that. As far as the job, you guys, it was a work from home job. And when I was so frustrated that day, somebody gave me a link and I went to it, I applied, and they immediately gave me an interview. And they told me I had to go through 2 weeks of training, but I could get it. So it's a work from home job. And I'm super excited. I used to have 3 jobs. I worked my whole life. I have no problem having people come up and even show that. I can show it. About 2 months ago, things got really bad. And I have the documentation from U of M for my disability stating she can't even do household chores. She really needs help. She cannot work right now. So, gosh, any other things? 'Cause I can answer all of this. I have no problem.
I just wanted to address the comment, cousins. I've been in the medical field since 2019. I've done CPR numerous times. It is not true. You do not always break ribs just because you do CPR. And it doesn't mean you didn't do it correctly if you don't break ribs. That is ridiculous. I've done it plenty of times and watched it plenty of times. Sorry, I just wanted to clear that up because everyone in the comments is saying if it's not done correctly, it wasn't, or if you don't break ribs, it's not done correctly. That's not true. But I'm done. That's it. Thank you, Patty.
Yeah, they didn't even do a full set. I've had CPR done on me before. And I've never honestly had a rib broken. But as far as cancer, Mallory, yes, I did have ovarian cancer. That was years ago. I talk about it a lot. I update people.
Fuck 'em all and they mama. How many options?